Welcome and thank you for taking the time to join us today for this valuable and timely webinar. I'm Shelley Myers, Business Success Coach for Practice Better, and I'll be moderating today's webinar. So we realize many of you have had to adapt and pivot your practices over the last several months due to COVID, and may be wondering how you can transition from the surviving phase of the pandemic into the thriving phase for your practices. So we thought this would be a perfect topic for our Practice Better audience. We're so delighted and honored to have both Laurie Hofmann and Tom Blue from Virtualpractices.org here with us today. They're excited to be here and share their expert advice and resources to help you thrive as a practitioner in the COVID era. So if you're not already familiar, Virtualpractices.org is a collaborative initiative to contain the spread of COVID-19, protect high-risk patients, and sustain the functional and integrative practice ecosystem through this pandemic. Their very robust website is an aggregation of the latest tools and resources available to help you pivot your practice and take action now to provide the most value to patients. They really need your expertise and guidance. So with that, I'd like to introduce you to today's experts. So we have Laurie Hofmann. She's a seasoned chief executive, board chair, visionary, and strategic advisor who has successfully led large-scale strategic, collaborative, and global development initiatives for leading functional medicine professional education and training organizations, healthcare systems, entrepreneurs, and industry leaders. She's the former CEO of the Institute for Functional Medicine and is a founding partner of Ovation Lab. Laurie's 30-year track record of accomplishments has served to advance and significantly expand the awareness, reach, and traction of functional medicine and personalized nutrition. We also have Tom Blue, who has dedicated most of the last 20 years to intensively researching and synthesizing new approaches to accelerate the application of emerging science and research in the day-to-day practice of primary care and personal health management. He is a founding partner of Ovation Lab and serves as the Director of Industry Strategy for the Institute for Functional Medicine, a member of the Board of American Nutrition Association, a member of the Leadership Council for Personalized Lifestyle Medicine Institute, and served for nearly 10 years as the Executive Director and Chief Strategy Officer of the American Academy of Private Physicians, the National Professional Association for Concierge and Direct Primary Care Physicians. So they are definitely experts in this field, and we want to welcome Laurie and Tom. We're so glad you're here. So to kick things off, Laurie and Tom, can you share a few COVID-19 updates and lessons learned to date from the virtual practice community?
You bet.
Yeah.
So Laurie, would you like me to start?
Yeah, why don't you start, and maybe first we can just say we're delighted to be here, Shelley and the Practice Better team. Thanks for having us today. We're very much looking forward to this conversation.
Yes, we definitely are. This is really, we're enormous fans, of course, as Shelley knows, but are huge Practice Better fans. So anyway, so you know, lessons learned. This has actually been a weirdly instructive catastrophe in so many ways, and not the least of which has been the insights that have been provided for as it relates to the fragility of practices, and you know, some practices we've seen do well, and other practices, you know, many practices we've seen really take enormous hits. And you know, and so we actually have sort of lead off a whole education series on this that you know, with what we've referred to as 5 lessons kind of taught by COVID, and I'm sure there are many more, but we kind of teased out what we felt like were the 5 biggest lessons, and in the hope that we can take these as opportunities to sort of refashion our practices, not massively overhaul, but refashion to be more anti-fragile in the times ahead. And I will say the conclusion that we've drawn is, and I would certainly invite anybody to challenge this, but I really don't think, I think this is true, is that the situation that's in front of us, despite the fact that it's battered up, beaten up a lot of practices, if you step back and think about it, and think about who are going to be the biggest value creators in healthcare at the moment in the context of COVID, and you hold aside patients that are in the hospital, because obviously they're now in a different healthcare world, the biggest value creators are going to be the people who have training in supporting the host defense, immune support, and know how to use root cause principles, nutrition, lifestyle to build resilience and robustness in people and help blunt the effects of an infection should that occur. And who are the best trained people in the healthcare system to do that? Well, people trained in root cause medicine and who are skilled at assisting people in behavior change. And so I suspect that this is exactly the group that we're talking to. And so the key is that we need to make the necessary logistical changes to enable practitioners to engage and to sort of re-engage and establish themselves as sources of real value in the context of COVID. And then by extension, one of the great lessons that COVID is teaching the public is the difference between the enormous difference between disease management and disease reversal. So patients that have well-managed diabetes, well-managed hypertension, COVID sees right past that and exploits all kinds of vulnerabilities. And so I think that this probably in the longer term is gonna awaken a whole nother level of motivation among people to just sort of do away with this notion of okay, I've got my numbers are under control despite the fistful of pills that I'm taking every day. And really seek out root cause resolution to a lot of their chronic conditions. So that would be my preamble. What do you think, Laurie?
No, I think you hit all very important points. And just to punctuate the last point that you're making, as we know, and as we're seeing this COVID era both extend and learn more about the many manifestations and even long-term effects of COVID, even for people that have mild symptoms or are asymptomatic, that these underlying risk factors and comorbidities, as Tom said, of hypertension and diabetes and obesity are enormously important. So as Tom really highlighted, not just managing these conditions, but really looking to get further upstream and actually reverse them is critical, not just for, of course, the condition itself, but as we see that being expressed through COVID. So I think that's one big thing. Another thing I think we'd say in terms of lessons learned is that we really saw that many practitioners, of course, were unprepared, like we all were, for the moment when suddenly they weren't able to see patients and they weren't yet pivoted to really being set up in some kind of a virtual practice. And as Tom has done a terrific job of encouraging people in our masterclass series, the telemedicine or telehealth component is just really a means to the end. I mean, it's a necessary feature, something to get accomplished in order to really be able to deliver and explore some of these alternative revenue models and initiatives and outreach strategies. So I think that's been another thing that's been hugely important, is helping to support practitioners of all kinds to just get set up in telehealth so they can really take advantage of, frankly, some of the silver linings and opportunities that COVID has presented.
Awesome. Thanks, Laurie. So given that COVID is a highly contagious and infectious disease, it would be easy to imagine that many of our practitioners are feeling irrelevant or unable to provide real value to their patients or clients in this context. So how do you see practitioners providing real value during this COVID era?
Go ahead.
Well, yeah, this is actually, I think, kind of the first step in a process of re-engaging and reactivating practices is to number one, to recognize relevance. So as I just said earlier, the the reality of the matter is that the best trained people in the healthcare system today for, to bring value to patients who aren't in the hospital are people with root cause medicine training and are skilled at assisting people in navigating and achieving sustained behavior change. So there's that recognition, and then there is an opportunity to then look at COVID almost as a workshop opportunity to build programs. And I know that the concept of programs is one that's very that resonates with the technology at Practice Better, and certainly the user base. And so one of the things that we've done has been to try and illustrate what one of these programs would look like. And it turns out actually that for folks that are newer to the idea of bundling together a program, that COVID makes for a rather easy one to do, because it only branches in two directions. Either a person is symptomatic and turns out to be infected, or a person is at risk, concerned about it, and wants to be on more of a preventive track. And for purposes of today's discussion, probably it would be more constructive to talk about the preventive track. However, I would punctuate this and say that there's also a really cool opportunity for, not just in the context of COVID specifically, but because of, the virtualization of practices and kind of the reshuffling of the deck, for all kinds of new collaborative relationships to form around care teams and coaches and nutrition professionals to open new conversations with medical practices about how to work together. Setting that aside for the moment, on the preventive side, what we've done, and we laid out on virtualpractices.org a visual of this and kind of mapped it out. But the biggest challenge actually of building these care paths for this purpose was actually to infuse some tools to make it come to life. And so in this case, we thinking about, okay, I mean, we've got kind of two types of people in quarantine. We have the kind of people that are like we see, referenced a lot on TV, that, it's like, their lifestyle's disrupted. I'm this way, actually. It's like, I'm used to traveling around all the time and not really sitting at a desk that much. I mean, I had a laptop, but I rarely sat at a desk. And now I'm stuck here all day long, every day. It's like, I don't go anywhere. So it's been really kind of disruptive in a negative way to my whole lifestyle. But then there's other people that are like, meditating 2 hours a day, and they're eating from their garden and working out for another 2 hours. It's like they've never been healthier. So we've got these two groups of people, both of whom, may very well be quite activated and concerned with their COVID risk, but have very different profiles. And so on the first group that's sort of creeping, that has escalating risk as a result of quarantine, we created worked with a company called I'm Aware to build a little home lab kit that is relevant to everyone here. A consumer can order it, or you could facilitate that measures. It's called the Lifestyle Risk Check, and you can find it at lifestyleriskcheck.com. But it's a little $89 panel that is a blood spot thing that looks at hemoglobin A1C and glucose, HSCRP, and vitamin D. And so now, for the person who's probably creeping in the direction of insulin resistance or whatever, there's a tool to quantify that and get traction in creating a behavior change program to follow. For the other group that's quite health activated and clearly not migrating towards higher risks, we've been very excited to unveil a test that Toolbox Genomics created. It's a genetics test looking at, they call it the Respiratory Resilience Panel, and looking at those factors that are just sort of under the surface and out of the control of the person, but that are predispositions to nutrient depletions or low nutrient levels of immune support nutrients, and predispositions to some of the conditions that are known risk factors for COVID. So two different ways to engage two different people, and then choreographing a care path around coaching sessions and behavior change interventions. So anyway, I kind of forget what the first question was, but I see a person. The second test is the Toolbox Genomics Respiratory Resilience Panel. I should also say that if you go to Virtual Practices, there's a whole section on testing. Everything we're talking about, you can find links to on virtualpractices.org, and it's all provided for free. So make use of it as much as you can.
So Tom, would you be willing to show a little snapshot of the care path, the
Oh,
COVID?
sure. Yes, yes, yes. Let's
I
see
think
here.
that is
I will
so
hunt this
helpful.
down and screen share with you guys a picture of the care path. All righty. So here it is. Can you see this?
Yeah.
Okay, great. So this is a zoomed out version of this over here, and what you can see hopefully is there's, this is sort of color coded, and as I said, it branches only in two directions. So the what is on the left hand side is the care and surveillance. And by the way, you can download the PDF of this, so don't feel any need to like take notes or screenshots or whatever, because it's all available for you for free. The significance of the box colors: the blue boxes are encounter forms, or excuse me, are encounters. They're touch points. And so when you zoom in on these, you start to see, oh, look at this. Okay, they're actually pre-coded. So for practices, or if you're working with a medical practice, even if it's out of network, doesn't bill insurance, this is a really weird kind of once in a lifetime chance to do a program and actually give a patient the encounter forms from the program. And because it's related to COVID, they have very decent odds of submitting that claim on their own and getting reimbursement for it. And so it's kind of a neat way of sticking your toe in the water and not having to be too self-conscious about the fact that there's a private pay cost, because the payer system's being so accommodating. So these are all touch points, and what you'll find in the right hand side, which is the preventive track, is and frankly on the left hand side too, is that like most health interventions, that are sort of root cause focused, the bulk of the weight of the work is actually carried by kind of the nutrition and coaching experts. It's the work of the doctor. It may be to interpret a lab, but again, in the case of COVID, it's not. These aren't super complicated labs to interpret. You have it or you don't, or you are antibody positive or you're not. I mean, there's a little nuance to it, but not much. It's mostly about the behavior change and the application of nutrition and lifestyle to lower your risk profile. So it's really kind of neat in that way. And so we put at the top of the screens here, I'll show you just to give you a sense of the tool set. As we got into this in the early days, there was no access to testing, and still it's difficult, but not horrible. We've been able to curate that a bit. And so we realized, and this applies to any program that you build, at least in my opinion, is you have to think about, okay, there's a protocol for the intervention and a way of making decisions, but then you have to think about the experience of that and how do you kind of bring it to life, and where does it need reinforcement, and where do you know you need traction, in order to make a behavior change happen, and you need to insert a tool. And so, we inserted this tool, Ask Sophie, which is an AI chatbot that's been trained to assess COVID risk through an interview, essentially, that a practitioner can navigate through, in their Practice Better telehealth consult. That little icon there is symbolic of a symptom tracker through a company called, oh gosh, the name's escaping me now, Open Health Network, that built this for us. All the symptom trackers would only report the symptoms to the CDC or whatever. And so we realized it was like, look, we've got to be able to get the symptoms to the practitioner and not just the government. And so they agreed to build a version that allowed the patient to say, okay, my practitioner is whoever, and they can email the symptoms. And so anyway, and then we have a bunch of, the intake packet, the protocols that you guys have already integrated and made accessible. And so so these are all tools that kind of have come to life. Then you get into the next phase of it. There's a bunch of testing resources, and then finally this encounter form workbook, which, anybody who might be in a situation where they could enable a patient to submit their own claim should download this thing. It's a really cool kind of once in a lifetime tool that would allow patients to get reimbursed. So anyway, and you'll hear, if you go to the site, there's a video of a doctor that helped us build this. Her name is Christine Burke, and she's fabulous, sort of talking about the thought process and how she's implementing it, that kind of thing.
So Tom, where would, oh, I'm sorry.
No, go ahead.
Where would practitioners find, if they were recommending nutraceuticals, is there a place where they can easily access these nutraceutical protocols without the need to build those out whether it be a dispensary or somewhere that they get their nutraceuticals from.
Right, right. Now you guys put in, correct me if I'm wrong. Now did you put in the nutraceutical protocols into Practice Better?
No, so we do, because we are integrated with FullScript. If you pull the protocols from,
Right.
you have them on, it's on the IFM website. So you pull them into FullScript as a template, and then in Practice Better, you can just easily pull a FullScript template into a Practice Better protocol. So you would have all the nutraceuticals there. You can obviously tailor those, but then you can add the lifestyle, food recommendations, all the other recommendations around that, but you're not going to have to be typing from scratch all the nutraceuticals in the
Got it. Okay, so what we did was we assembled an expert panel and took the very large nutraceutical protocol, that sort of the one-size-fits-all version, and broke it into quadrants. And so that's what you see here. And FullScript has integrated this, as has Wellevate as well, into their protocol library. But basically, we said, look, we'll take low risk and high risk as one dimension, and then symptomatic, asymptomatic as the other. And so now you've got 4 boxes, and the ability to, for lower risk asymptomatic patients, not kind of overdo it with supplements that they may not need to buy just yet. The interesting thing that we've run across, though, is even still today, here, I'll stop sharing so we can all see each other. The problem that a lot of people are having are that things are on back. There are 2 problems. One is back order. It's like the active ingredients that are sort of immune supportive don't tend to be around and reliable. And then the second problem that we hear is that buying these things active ingredient by active ingredient, it becomes a rather expensive bundle of supplements. And so what we have a sponsor that has developed an actual immune support kit called Protect Wellness. You'd see it at protectwellness.com, and it's a really fascinating kit, actually. It's a fraction of the cost. It includes the ingredients, and interestingly enough, I've never seen this done before this way. You buy your initial purchase is a box that has 3 bottles in it. One is a daily thing that you take every day, and it's got the kind of this immune support protocol built into that. The other 2 you set aside in the event that you become symptomatic, which actually kind of makes sense, because given the fact that, it takes a while sometimes to get supplements delivered, it's kind of a good idea to have on hand the boosting supplements that that come with this. So I would encourage folks to take a peek at it and look at the active, the dosing of the active ingredients in the thing. It's a really neat kit. And it's something you can get, your practitioners can get through there or through dispensaries as well.
I had a thought a moment ago, but I think we moved on from it. Tom, I think going back to the care path for a second, if you want to just share that screen again, you might want to, I think there have been a few questions in which people are trying to understand what looks like a very dense, sort of complex document. So it might be helpful to just let everybody know that there's a whole section that's called really the care path tools, and their individual links. So I think what we'd recommend is that you just try 1 or 2 things, check out the symptom tracker or something. And again, everything is all linked here, including the lifestyle and nutraceutical protocol that Tom just showed. So while it may look like it's very dense and intensive, the idea was to actually include and integrate a lot of kind of cool tools and apps and features. But don't be daunted by how it looks visually. Honestly, just go there. There's a PDF you can download. All the links are live. You can click on and just check out sort of one thing at a time. Tom, you want to add anything to that?
Yeah, that's a fantastic point. And again, when you download this PDF and you look at it, you'll find that it's complicated only in that we've called out every encounter and coded it for you. And the protocol part itself is actually quite simple. And I see a really interesting question about, does it require the use of supplements? And the answer is actually no. You could achieve the same kind of risk mitigating effects with sleep and stress management and getting on the appropriate food plan, and do it with nutrition as well. In fact, the one of the tools we just unveiled very recently is from a company, AIME Health, AIMEE. Is that in our library of resources yet, Laurie?
Yes, it is. And while you're describing it, I'll pull the link up and post it in the chat.
Yeah, this is a really neat one for this particular question, because it's a protocol that it's an intake quiz that is being provided for free to practitioners that Deanna Menick, the functional nutrition genius, actually was behind creating. So it's really well done. And then out of that, you get your sort of immunotype, which is cool. And so you're assigned to an immunotype bucket, and then you have essentially food plans that are recommended. So totally free tool. The first step, as everybody I'm sure listening would probably agree, is you've got to kind of capture the attention of people. And so whether you do it through a lab test like the lifestyle risk check, or whether you do it through a quiz like AIME Health has created, another interesting way is to speak to the role of drug, the pharmaceuticals people may be taking, and the nutrient depletions associated with those drugs that relate to the immune system. And so we have a PDF on the site that actually looks at the immune supportive nutrients and the drugs that deplete them. And so a great example is proton pump inhibitors. The people that have been taking these for a long time, obviously they have problems with nutrient absorption and have a risk factor that you wouldn't have thought of. Now, what was really cool about this is that we've been talking about this for a while, and only recently a study came out showing PPIs as a risk factor for COVID. It doesn't. I don't know that it goes into the why of the fact that you can't absorb nutrients that are known to support your immune system, but that's been very interesting. So that's yet another way that practitioners can kind of spark the interest of people that that may not be associating their particular condition with a risk factor.
Would you say within your community, are you seeing a lot of collaboration between, a physician and health coaches? Like, are health coaches and nutritionists approaching these physicians to say, hey, I know this care path is very robust and I can come in and help you with that? I feel like this is a great opportunity for health coaches and nutritionists and dietitians to work together and network with physicians in their community.
I totally agree with you. Completely agree. And again, it's one of the pieces of advice that we give to medical practices is, look, you've got to be as lean as you can with your overhead and your footprint, and start looking to an extended care team that you can work with, not just for COVID, but for other things. And so yes, I really think there has never been a better kind of time, or the ground has ever been any softer for sort of planting these ideas in the minds of potential collaborators, and knowing, it's kind of great that you mentioned this. It's like, the coach or the nutritionist shows up kind of pre-educated on the approach. And another thing that I think, this notion of being pre-educated in things, one of the things that I would suggest that people start, if you're drawn in this direction, start considering pre-educating yourself on, is the use of digital health tools and wearables. And so for remote monitoring stuff. So, what we're seeing is that everyone's excited by the idea. It's cool. There's gadgets. You have your Oura Ring, and whatever. But the truth of the matter is that most physicians don't have the time to learn, how do I implement a program that integrates devices, and are there tools that aggregate this data and put it in a dashboard view, and to the extent that coaches, nutritionists can show up, it's like if you're digitally minded with that capability, it's a whole nother realm that you can unlock. And of course, all of these sort of digital biomarkers are lifestyle driven and lifestyle affected. So ultimately, these are the practitioners that are going to be really moving the needle on those markers as well. So I think that's another kind of area of if you got spare time, to kind of dig into this a little bit, because the tools have reached a level of maturity that make this very feasible.
Yeah. Tom, there've been a few questions or comments that really get to something we haven't mentioned yet, which is, in addition to all these tools and processes and workbooks and resources being available on virtualpractices.org, we also have a private Facebook group, and you can just search in Facebook under Virtual Practices. And what we've done that's been really wonderful is a couple of our colleagues who are very much marketing and digital marketing experts have been convening Marketing Mondays. And so if you go on the Facebook page, you can look back and watch some of those presentations. They have provided just a tremendous amount of value and have really engaged the practitioners in helping to direct not just the conversation, but the topics. And what it's really trying to get to is something that practitioners have really set as an issue for them right now. And that's both the re-engagement of their existing patients, as well as strategies and really practical tactics for reaching out and attracting new patients. So again, the Marketing Mondays team has done everything from some digital health kinds of best practices, but also how to convene a virtual town hall. So definitely check that out.
Just real quick, I want to mention, because we were talking about tools. So the COVID intake form, I just want to mention for those of you who haven't already seen that on Practice Better, that is already built into Practice Better. That'll give you a little head start. You're not going to have to build that yourself. So if you go under the public templates, you will see the COVID-19 intake form there. So you can just put that right into your account and you'll be ready to go.
That's a great, I'm actually glad you raised that, Shelley, because what that is, as you'll notice when you look at it, it's not necessarily just for people infected with COVID. What it does is it takes the kind of functional medicine intake forms and alters the questions to contemplate our current reality. So, life before and after quarantine, has quarantine affected your sleep? So it reads as is very current when you go through it and use it.
Yeah, something else that I'm curious about is, Shelley, given your background and experience and obviously role with Practice Better, maybe you can help us understand what are the kinds of concerns and considerations that you're hearing from the health coaches and nutritionists and practitioners from Practice Better.
I think a lot of it has to do with just the telehealth and people that are moving from a clinic into telehealth and practicing across state lines, and what can these health be staying in their scope of practice. With the launch of the team plan now, you can have a physician and health coach and nutritionist collaborating on the same platform. But if they're not on the same platform, it's just how do you share information in a HIPAA compliant way? So that's a big one. And then I see a lot of talk about how to automate and scale. So how can we take what you were just talking about on the care path and create a program that you can either do with a group or do sort of an evergreen that doesn't take away from the one-on-one, but sort of the education, putting in the intake forms, putting all of that in a program in Practice Better so it can sort of be automated, the education and the administration part of it, and then you can build in your one-on-one sessions. So there's just been a lot of questions on how people are doing that, how much do they charge, things around reimbursement. Our patients, if I give them a super bill, are they going to get reimbursed for these sessions with me, or am I going to get reimbursed if I submit it? So those are some of the big things I'm seeing in our community.
Yeah, well, I remember you telling us on a call maybe a month or so ago that that's one of the really unique features about Practice Better is that your clients can build programs into it. And, Tom, this might be a great moment to talk exactly about this, that one of the things we realized as we really started working with now thousands of practitioners is that not just the information and the processes and the tools that we were providing were helpful, but then it reached that exact place in question of how do we implement it? And so Tom, maybe you can talk a little bit about some of the initiatives that, that we've created, and maybe prioritize those that would be particularly relevant for health coaches and nutritionists.
In terms of sort of the campaign, so to speak.
Exactly.
Yeah, I mean, again, thinking along the lines of that preventive care track, it's mostly, I think, about hooking the interest of people and making people realize how relevant this all is to them. So the big ones would be, the nutrient depletions, the lifestyle risk check, the genetic test for, from Toolbox. Another one that if you're working collaboratively with a physician, the antibody testing is one that is an enormous, it's just an enormous opportunity to spark up interest, because people that are obviously interested enough to go get the antibody test, they find out, as most do, that they're antibody negative. The conversation that follows is like they're disappointed. They don't have any form of immunity. And so then it's a perfect time to then introduce the conversation about how do we kind of create more sort of robustness in the person on the back end of that. So I love the antibody test as a catalyst for this type of conversation, though it does require a relationship with the doctor. Now, here's another interesting thing. Thinking about coaches and nutritionists opening doors with physician practices, I am finding that many physicians are unaware that they can get a home kit for antibody testing, as an example, or they're unaware that they can get their hands on a really high quality rapid antibody test. And so the ability for a coach and nutritionist simply be aware of these, of the testing resources that have been curated here, and say, look, here's how we could do this together. It makes it all possible, because in their mind, they might be thinking, well, I don't have protective equipment, so I can't be swabbing people. And, I don't have a phlebotomist, so I can't do antibody testing. Well, in fact, none of that's the case. So I think it would be worth people's time just to understand the tools that are available for sparking up those discussions.
Yeah, I also think that, Tom, you mentioned, and it's been relatively new for us to get acquainted with and incorporate the Amy Health materials. But again, I think for nutritionists and health coaches, there's some very interesting opportunities to both get leads, frankly, and to stimulate some interest. So they have, and I posted it in the chat, I'll do it again here in a second, but the assessment helps to identify an immunotype and a viral risk score. And again, the patient or client does that all on their own through the Amy Health portal, but then the practitioner is able to actually look at a dashboard of the clients and patients that have taken that. And it also produces sort of a protocol or a guide from which coaches and nutritionists could certainly customize that. So again, I'll log that, that website address in here now.
So having now had a chance to interact with and study such a large number of practices in your community, are you able to shine any light on what practice characteristics seem to be the most helpful right now, and where the common practice vulnerabilities are?
Well, yeah, this is, and actually it's interesting, because a number of the characteristics that are problematic for physician practices are ones that can be remedied, through a collaborative care team, particularly collaborative care team where where one of the collaborators is working with Practice Better, given the resources that are kind of built into that tool. So a lot of people, I think, when all of this happened, intuitively the conversation was pivot to telehealth. That as though the presence or absence of telehealth would dictate the future of the practice. And what we've actually seen is that, as Laurie said earlier, it's telehealth is a necessary but not at all sufficient capability to help a practice move forward successfully, and that in fact the presence or absence of telehealth tools has not been hugely predictive of whether a practice has been successful. What we have found, however, is that there are a couple of areas that have been, and one is they have a lot to do with engagement. And so there's engagement, there's engagement in a care path, and then there's engagement that's born out of a particular revenue model or the way the financial relationship is crafted between the practitioner and the patient. And so I'll start with simply engagement in a care path. So a number of particularly physicians, and when they are navigating a care path independently, they don't have a coach or a nutritionist. The care path is very vivid in their mind. Where is this relationship going? What are the steps we're going to take to achieve the outcome that the patient has engaged the practice to try and achieve? And yet, as vivid as it is in the physician's mind, that the patient is left with the perception that the care path is somewhat spontaneously generated based on, the next visit and the next lab test, and that the doctor's just sort of, building the next mile of the road in front of them as they go through these visits. And so what we found is that there's actually a striking difference between practices that have done a very good job enabling patients to see the whole road in front of them, what the program looks like, what the timeline is, what the milestones are, and here's where we are today, and here's how we're getting to that final destination, versus practices where the patient sort of feels like, well, this is kind of being spontaneously generated, and I just won't get I guess the news told me I can't go to the doctor's office, I shouldn't get any more visits, so I'll just wait until the smoke clears and I'll kind of re-engage. So that type of patient, simply for lack of a line of sight into what the care path really looks like, is just they're less engaged and more willing to push pause on everything than the patient who is in a care path that they see and they don't want to interrupt it. And so number one would be making sure, number one, with your own clients, but probably more likely, an opportunity is to assist other practitioners that aren't doing this in making sure that all of their patients actually see the vision that's in the mind of the practitioner. So we actually built a tool to assist with this. And because this sounds like a tall order. And in fact, it's actually not that tall of an order, but left to people's own devices, they kind of take it overboard, and they're like, well, if I'm going to do that, if I'm giving a care plan to every patient, I've got to write this giant novel as to where this is all going, and it's going to be a lot of work. Well, what we did was, and this is available on Virtualpractices, it's called, I'll share my screen. It's called the Health Action Plan. We created this thing. So this is an Excel document, and what it forces you to do, and this is something you can literally co-create in a session with a patient, is to say, okay, what are our top 5 quantitative markers, that where it could be, weight or waist circumference or a lab value or whatever, what are the numbers that we're tracking that that are going to lead to whatever the objective is that we're seeking to achieve. And then we've got a couple of simple sections that are necessary to co-create, which is like, look, and this is so intuitive to nutritionists and coaches, but less so for physicians, but understanding, like, what does success look like in the mind of the patient, and making sure this is captured, and then understanding kind of where the patient perceives they are today, and that is captured. And so in doing this and painting the picture of success, out of the mind of the patient, not the judgment of the practitioner, you create, as all the behavior change experts that know far more about this than I do on the call, you create kind of a sense of commitment to sort of living up to what they just said they wanted to achieve. And then finally, there's a simple to-do list out of this. So here's an action plan for health management prevention, for lifestyle and education programs, and we've got dates, and are they done? It's a to-do list. And then last but not least, to the extent people are on supplements and medications, they can see them and they understand why they're on them. And again, for those that want to be stopped, we've got like objective dates on when we're going to try and de-prescribe certain things. And that's the extent of it. And so it's not, you don't have to create a book for people. It can be as simple as this, and or make your own template or whatever, but making sure that you don't make the mistake of having a bunch of patients who can't see the road in front of them and therefore are more willing to disengage. The second actually pertains to the financial relationship between the patient and the practitioner. And so here's what we've seen. In my opinion, the number one source of practice fragility and vulnerability is a fee-for-service revenue model. And so this is a pay-as-you-go revenue model. I'm going to show you a graph to really drive this point home, because this sounds weird. It's like, why would the revenue model have anything to do with whether the practice has fared well or poorly in COVID? And so let's just see here. I'm going to show
Tom,
you.
while you find that, can I just interject a comment? This consideration around having patients and clients understand where you're headed together, what their care plan is, and how it is not limited to just, as Tom is saying, a certain number of visits. What we've seen across the functional medicine ecosystem is that it's very typical for patients to stop coming in when they start feeling better. They haven't completed the care path or the program, but they're starting to feel better. So they're like, good enough. So it really, really reiterates the point that we try to make in virtual practices, and that Tom, I think, has spent so much time thinking about and developing. And that's not just the programs themselves, but then some kind of a maintenance program that extends the relationship beyond, okay, I'm feeling better, I'll step away. I finished the program, I'll step away, but really kind of cements a long-term relationship. Go ahead, Tom.
Very, very, very good point. So are you guys seeing this little graph?
Yeah.
Okay, good. So this is a graph. There's a company called Hint Health that is, that in the direct primary care and concierge medical world, they do membership billing for medical practices, and they have almost a monopoly in that space. So they have, I don't know, several thousand practices that they do membership billing for. So I asked them if they would pull a report of the paid census of members in the direct primary care and concierge medical practices. Now let me just say, a direct primary care practice is typically a conventional primary care doctor who one day decides they would prefer a membership subscription model over insurance. They're sick of the payer system, and so they just switch. They convert, and the patients that join, and those that don't want to do that leave. They don't go get special training in nutrition and behavior change and root cause medicine. They just changed, and they're doing the same thing that they used to do. They aren't, they tend to work with patients just in their local area. They aren't telehealth experts. Most of them haven't taken any special measures to have a special virtual practice capability. So here's what you see is that over the course since from March to the end of last month, not only was there no attrition in membership revenue across these practices nationally, but it's actually grown by 4%. And so my point in saying this is that if you step back and think about for a moment, like, why would a revenue model have so much to do with the retention of revenue and retention of patients in the COVID crisis? Well, let's think about it. The news says, stay at your house, don't go out. For heaven's sakes, don't go into a medical setting. You could get sick. The patient who is in the fee-for-service pay-as-you-go model, the first question that they ask themselves are, well, crap, how long can I go without health care? The patient that's in a subscription model, the first selfish question they ask themselves is, well, how do I make sure I'm not wasting money every month paying for a membership to my doctor's office? And so they wait and figure out, how they continue to get value out of the practice, and they wait for the practice to say, here's how things are going to work, because guess what? The middle of a global pandemic is not a great time to be firing your healthcare practitioners. So it doesn't make sense to sever ties. It makes sense to wait and see how value is going to be delivered. And the practitioners rise to the occasion, and they get a telehealth tool, and they say, here's how it's going to work. So it's weirdly enough, this seemingly simple thing has proven to be so powerful as a tool of anti-fragility in helping practices kind of survive and thrive in this. So the advice is that, look, if more than half of your revenue is generated through fee-for-service income, not to do away with it entirely, but begin to work programs and graduating people from programs into a subscription maintenance program after that's kind of evergreen. And then you use the fee-for-service component as the overflow valve. So when someone needs something that's beyond the scope of the package you've created, well, sure, charge fee-for-service. And use it to make sure you're not giving away services because it simply overflowed. But that's been a huge takeaway as far as we're concerned with like what we've learned about practices that have done well and poorly through this crisis.
I think another thing that we've learned is that maybe 6 weeks ago or so, we all started hearing in the media, kind of face-to-face conversations, this term COVID fatigue. And one of the things that we've really tried to emphasize at Virtual Practices is to sort of resist, entering into that mindset, and with the thought that, okay, we just need to like get through this so that we can, go back to normal. But that by all appearances, we will be in this for a while. And as Tom said early on, all of you are really the very best trained to be able to address this now longer term COVID era. So not just COVID, and all of what we've presented is in Virtual Practices, while it was catalyzed because of COVID and that crisis, it is intended to really serve as a use case for transferability and applicability to other kinds of conditions. So all of that is to say is that we know there's a lot of weariness about just the state that we're in. And yet I think we're all trying to develop our resilience muscle and to recognize that we're going to be in this for quite a while, and that all of you have an enormously important role to play.
You're muted.
All right, thank you so much, Laurie. So would you mind just kind of going over a little bit about what people can expect going to virtualpractices.org? Like, what's the very first thing they should do when they go there? Where would be the best place to start?
You take that one, Laurie.
Okay. Well, we do recognize that there is a lot on the website, and it's organized across main menu or navigation items that are intended to really reflect the process. But if you had to really start somewhere, I think I would start in the section that's called COVID era, because that's where many of the assessments, the tools, the care path, all of that really lives, and it's a great jumping off point. The other area I think to explore is resources, because over time we've loaded more and more resources, interviews, sort of new features, new offerings and tools that we've become aware of. In fact, the health action plan that we were just discussing is in the reopening section. So we've tried to include sort of almost double populate and include most everything in resources. So that's where I'd start. It's all very valuable. There's a telemedicine section. There's a testing section that goes very deep into many of the tests that Tom highlighted in terms of both PCR diagnostic testing as well as antibody testing, and whether it's home collection or in office. So I'd start in the COVID area and resources. How about you, Tom?
I couldn't agree more. I think that's great. And then to the extent that this whole line of discussion is useful, we've got some of the education series that have been recorded where people wanted to dive into a deeper discussion of revenue models and engagement or whatever. There's a module on that they can listen to an hour of, and see all of the slides I've been sharing have been pulled from the the decks that are behind the these programs, so people can watch recordings there if they like.
Right, and several people have just asked about specific slides. Again, everything Tom showed that was a tool or resource, you can find at Virtual Practices. You put your email and add and name in one time and you're in. It's available anytime. Of course, there's no charge for any of it. But if there was anything from the slides, like the direct primary care or the hint health slide that Tom showed, if you just email us at impact@virtualpractices.org, we're happy to just send you a copy of that slide. Someone has asked a question about, are we intending to create a care path that would be post-COVID? So as I said a couple of minutes ago, while this is focused around COVID era at this point, that's very much our intention. We're recognizing not just a COVID recovery care path, but other now associated care paths. And after Labor Day, we'll begin to start to unveil some of those. You know, Shelley, there is one other thing I might mention. I think this may be useful for the audience here. One of the big areas I wouldn't call it so much a vulnerability, but an area that we have identified surprisingly how much lack of confidence there is in the engagement of clients and patients, and particularly marketing messaging and communications and social media. And it's actually why we started Marketing Mondays, was to address some of the non-clinical but really essential aspects of having a thriving practice. So again, for all of you that are listening and watching today, we get that these are hard things. You know, you're trained to really be a clinician and to work with patient and client care, but you're also expected to be a great business person and a communicator and a presenter and a marketer and now a social media ninja. So we've begun to really try to build out some of those things as well, to try to support some of the non-clinical aspects that are essential.
So if folks go over and register to get on the website, if they're having any issues, you mentioned an email address that they could email.
Sure, I'll pop it in the chat here again, but it's just impact@virtualpractices.org.
And somebody's asking, what is the name of the laboratory that was used for the test? What can I say to my clients when asked if they are reliable?
Yeah, go ahead, Tom.
So I wonder if this is probably the lifestyle risk check might be the question that people would. So this is a home kit that we actually, people that are kind of discerning around home kits ask the question of, well, glucose is not a stable measure on blood spot, and in fact, what you'll see when you look at it is it's a serum separating card that actually does preserve that reading. So they're a very reliable home kit company, and is I guess all I can say. But they were carefully curated.
And then what is the name of the Virtual Practices Facebook group? They apparently
just search under Virtual Practices on Facebook and it will pop up. You'll see.
Yeah, it is. I know it is under groups, so I think there are a few pages that are something different, but if you just click on groups, I think it's the only one that comes up.
Yeah, thank you, Shelley. Let's see. There are a couple people that have posted they have had trouble getting access to virtualpractices.org by putting your email address in. Again, anyone that has any technical issue at all, just email us at impact@virtualpractices.org and the IT team will quickly resolve any kind of glitch in your access.
So somebody's new to health coaching, would it be appropriate for them to recommend the lifestyle risk test?
I mean, given that a consumer can order this on their own, it's not that you're ordering, a lab for someone, and given that it involves a vitamin D level and a hemoglobin A1C and the and HSCRP, so an inflammatory measure, and the reference ranges are, it's like the report is self-explanatory. I kind of feel like it's okay for a consumer to say, look, these are, as you can see from the report, these markers are outside of the target range. Let's talk about lifestyle interventions to lower inflammation. And you know what I mean? I would say that this would be an okay. You're not diagnosing anything. You're just essentially providing education on how to move markers.
Yeah, you're educating them that this panel exists, and you're just
exactly.
Yeah. Shelley, there is something else you mentioned earlier that maybe would be helpful for everyone, and that's that you mentioned telemedicine and and that being something that there have been a lot of questions about from your Practice Better audience. And you may all be aware of this resource, but the American Telemedicine Association is really the national leader in both following what's happening with telehealth policies. We had the opportunity to do an interview with the CEO about a month ago, really, really informative. But sort of current news is just on Monday, President Trump and the administration signed a new executive order in which they are permanently extending some of the telehealth opportunities for evaluation and management and to Medicare patients. So I would say go to American Telemedicine Association, and where you can follow and really look at what the implications of that order are, as well as their recommendations and their interpretation of what this means for any kind of state-to-state practice.
We'll wrap this up here pretty soon, but a couple quick questions about the intake form in Practice Better and where to find that. So if you just navigate over to Forms and click on, in the bottom right corner, click on the Fast Action button, and the very first option is where you would go to see. So click on Templates, and then you'll see a list of all the public templates, and just click on the COVID one, and it'll download it into your list of forms. And then the other question was, can I use these resources on our Practice Better programs? So Tom and Laurie, there's no issue with them using any of these resources. If they're building a program in Practice Better and they want to attach, the intake form or any other resources that they got on your website within the program.
Yeah, use it as they like.
And everything is free. Somebody asked about any fees associated with virtual practices.
All free.
And we may just want to say, like, how is that possible? We've had, terrific sponsors and also opportunities to have virtual practices featured with all of you today. So they really are, we galvanized this effort, and I think in 3.5 weeks stood this website up back in late March and early April, and we're really pleased to be able to provide it through the generous support of sponsors.
Awesome. Well, thank you so much, Laurie and Tom. We really appreciate you being here and just, putting in this huge effort to pull all of this information into your website and bring all these people together to share best practices and challenges that they've overcome. I think this is going to help so many people, so many practitioners. So thank you again. I've had so many questions about this replay. We will be emailing this afternoon a replay email that'll include the recording. So thank you to everybody who attended today. Hope you all have a wonderful Friday and weekend. Thank you so much.
Thank you.
Thank you.